Say hey.
Waylon was put on extracorporeal membrane oxygenation, or Ecmo, 3 months after he was born. It was just a few days after he had eye surgery.
2 days after that surgery, they still couldn't take him off the ventilator and he was going down.
He was one of our premature infants. He had been in the NICU for quite some time. And premature infants are pretty fragile, of course. And he underwent a surgery, and that surgery really tipped him over the edge, and he got incredibly sick. His lungs started to fail, and we needed to put him on Ecmo to save his life.
Dr. Matthew Ledoux is the pediatric medical director for Ecmo at James and Connie Maynard Children's Hospital. He said Ecmo is
heart-lung bypass for really, really sick children. Sometimes children have their lungs fail or their heart fail, and in order to save their lives, we can put them on this machine where they can rest and can get better.
And in Waylon's case, it was the last option.
It was crazy. I really didn't know what to think during that time. And then seeing him go from the NICU and not on so many machines, he was on oxygen at the time, to being put on Ecmo, it was just a scary time.
Sarah, Waylon's mom, said her son was on Ecmo for 10 days, and without it,
he wouldn't be here. Children's Miracle Network funds go to Ecmo. They also go to the ventilators that he's on while he's on Ecmo. And without the Ecmo machine, then he would not have made it that night.
Dr. Ledoux said before January 2015, the Children's Hospital didn't have Ecmo machines.
And we saw children die in our hospital or get transferred far away. And so by having the equipment and opening this program, we know that children have been saved and have been able to stay close to home.
Now, Dr. Ledoux said because of Children's Miracle Network, the Ecmo outcomes at Maynard Children's Hospital are slightly better than hospitals across the nation.
All of our equipment to open the program came from money from CMN. And so without those donations, we wouldn't have the program, we wouldn't have the equipment, and we know children have survived because of it.
Waylon Denny survived.
Incredibly rewarding to know that we're saving children's lives, but then later to see them like Waylon growing up and doing well, and it's an amazing experience and feeling.
Without the nurses, doctors, and therapists, we wouldn't be here.